Guys, welcome back to the channel. So we have started with mucormycosis. We have seen the clinical presentation and the differential diagnosis. We'll be dealing diagnostic workup and treatment plan today. Okay, let's start. Okay, diagnostic workup. CT scan of the maxilla, orbit and brain. Intracranial vein abscess, sinus and orbital extension are recognized by membrane or periosteal thickening as well as bony disruption. So in CT scan, we see intracranial vein abscess, sinus and orbital extension by membrane or periosteal thickening as well as bony disruption. Then the third thing we do is serum glucose, electrolyte, blood chemistry and blood gases. These all tests are done for the diagnostic thing. Now, confirmation of the diagnosis is best obtained with टिश्यू स्पीसमेन. तो वो नेक्रोटिक और नॉन नेक्रोटिक का जो जंक्शन होता है वहाँ से हम लोग टिश्यू स्पीसमेन लेते हैं एंड इट विल कंफर्म द डायग्नोसिस. Now staining it with methamine silver or pass stain in addition to HNE. So ये तीनों stain use करते हैं for the staining of tissue specimen. Now coming to histopath part, fungi can penetrate vessel wall causing thrombosis and necrosis. The tissue shows non-specific acute and chronic inflammation with granulation tissue and necrosis. So mainly granulation tissue and necrosis are seen, no granuloma is seen. Only granulation tissue and necrosis. The large non-septi hyphae are seen. Sorry. तो जो हैं उनके हाइफे नॉन सेप्टी लार्ज हाइफे दिखते हैं. ओके, नाउ कमिंग टू द ट्रीटमेंट प्लान. It is a severe tissue loss and life-threatening disease. So mucormycosis is a life-threatening disease. Aggressive control and debridement are needed. So the main key for the treatment is the early and aggressive treatment. Is the main key for the treatment of mucormycosis. Okay, it should undergo a resection type of debridement obviously. और resection में क्या हो सकता है? Partial or total maxillectomy. So mainly it should go a resection type of debridement which include partial or total maxillectomy, and in some cases it includes ethmoidectomy or frontal sinus or even orbital extension. Okay. So the wound is left open for care and irrigation. So mainly we left the wound open for irrigation and care. The wound is not closed in these cases. Preferably we give removable obturator for speech and food as the maxilla is involved. So the removable obturator is given for speech and food because these two functions are basically or almost compromised after the resection thing. Okay, now coming to the drug thing, amphotericin B therapy should be initiated. Adjunctive nosafil 400 mg daily is preferred. So amphotericin B तो देते ही देते हैं, उसके साथ थोड़ा डोज कम करने के लिए एम्फोटेरिसिन का तो वी गिव नोजाफिल इज प्रेफर्ड. ओके, नाउ adjunctive hyperbaric oxygen should be also be used. So this is the new thing, hyperbaric oxygen should be used and it gives a good result. The HBO therapy reverses the hypoxia in the local tissue and enhances the neutrophil and macrophage killing ability, allowing the antifungal drugs to be more effective. तो ये HBO therapy that is hyperbaric oxygen therapy क्या करते हैं? It reverses the hypoxia condition. तो उसकी वजह से जो न्यूट्रोफिल और मैक्रोफेजेस का जो एक्टिविटी होता है, किलिंग एक्टिविटी और फेगोसाइटिक एक्टिविटी, वो बढ़ जाता है. तो अगर वो बढ़ जाता है तो जो हम जो ड्रग्स दे रहे हैं एंटीफंगल दैट इज एम्फोटेरिसिन बी और नॉक्सोफिल, उनका जो एफिशिएंसी होता है वो इंक्रीज हो जाता है बिकॉज दे गेट अ एनवायरनमेंट विच इज ऑलरेडी क्रिएटिंग अ थिंग. ओके, now prognosis. Death is known outcome of the disease. In 10 to 30% of the disease, death is like, hey, the prognosis thing. Hence treat early and aggressively. I have said already, the key point for the treatment is early and aggressive treatment. That's all about mucormycosis. We'll be starting next topic in the next class. Till then, like, share, subscribe, and comment. Bye.